So how did I get into clinical trials? Well, I guess I've always been in clinical trials from a junior doctor. I've always wanted to do things to make a difference, and I don't know whether I've got an inquiring mind or not, but I've always looked to do something different. So I think it's a state of mind, really. And hematology lends itself to these things. I mean, most of the conditions we treat, particularly if you look at acute leukemia, over the decades, every patient's gone into trials, but that's how we've improved outcomes. So if you adopt that approach in all conditions, then you're going to improve outcomes. So it's what I've always done. I've always worked for bosses that have been keen on clinical trials, so that's just further, I guess, engendered that idea that that's what you should do. And then when I became a consultant, I could manage that myself, and as well as running other people's trials, I've developed my own and run my own. So it's been my life, really, and now it's a greater part of my life. So I think it's very important, and if you really want to make a difference to patients, clinical trials is how you do it. How would you go about it? Well, I think it's a bit harder today than it used to be. The requirements, particularly from a bureaucracy perspective, the paperwork involved is quite exacting, so it's quite tricky. I mean, I think what I would advise people if they want to do this, and first thing is you've got to really want to do it, because it's quite a time commitment, and it's a time commitment over and above your normal job, if you like, is advice I'd give people is go somewhere where they do a lot of it. Go and find yourself a mentor, somebody that does it for a living, if you like, and then understand from them the processes, because there are lots of pitfalls in studies that other people have been through and understand. So go and talk to people that have done it, and then understand from them, and particularly for your staff that you'll work with, nursing staff particularly, again, get them to be mentored by somebody that does it regularly, because it's getting started is quite tricky. Once you're established, then it's okay, but there's a lot of attention to detail you require that you wouldn't necessarily understand until you make a mistake properly. So you just got to go and work in a unit or see a unit where a lot of trials are being done.